When we're feeling anxious, what happens in our body is that our limbic system, which sits deep within our brain, is activated. And this is a survival mechanism within the brain in order to react to perceived threat. And it might be a perceived threat or it may be an actual threat. So what we see throughout the body is a rise of tension throughout muscles, our breathing becomes more shallow, and our heart rate increases as well. All of these are about the body anticipating to move and get us out of danger. The other part of anxiety is that there are three main responses, and they are to fight, so become agitated or annoyed, and that's where we often see a rise of anger when we're anxious, or to flee, so to avoid whatever we're encountering that's anxiety provoking, or to freeze, where we become rooted to our position and cannot move. So this is where we experience all of these symptoms when we're feeling anxious. So stress is a normal reaction to daily pressure where we're feeling in demand. There might be tasks that we need to complete, maybe feeling under pressure of time. We may be thinking about whether we can actually do it or not, what resources we need. The difference between stress and anxiety is that anxiety involves a fear reaction. We start to feel that we can't cope and we start to worry about it. We project into the future, we worry about what the future holds. We often have a negative bias there where we start to think about worst case scenarios. Then in terms of thinking about the past, we focus in on the mistakes we may have made in the past. So anxiety is very different to day-to-day stress, and that's where it's helpful to have strategies to manage it. In terms of strategies for managing anxiety, we think about what the symptoms are of anxiety. So if we're thinking about the muscle tension that arises, we need to be thinking about strategies that help us to alleviate that tension. And often that involves movements which allow tension and release throughout the body. So we have strategies called progressive muscle relaxation, where we work from the top of our head through down to our toes, where we look at different muscle groups and we tense and release each of them progressively. And this allows our body to relax. When thinking about the other symptoms of anxiety, like breathing, where it becomes more shallow, we need to think about making that deeper and slower. So in allowing us to do that, it involves us taking a deep breath in through our nose, holding, and then breathing out through our mouth very slowly, making that exhalation long and slow. And with each repeat of that, it slows our breathing down. In thinking about worry, where we might be worrying about the future or worrying about the past, keeping a little diary in order to acknowledge and identify these worries, but also then think about what we can do about them, identifying what we're in control of, what we're not in control of, and making a plan to problem solve around those worries. In terms of deciding whether to seek professional help, it's thinking about the persistence of the symptoms. So as we know, with stress, it may ebb and flow and affect us day to day. But with anxiety, it's very persistent and you'll have heightened experiences of stress and anxiety. And thinking about the physiological symptoms of muscle tension, worry, and breathing, feeling very fast, and also heart rate. So sometimes people feel that they're struggling and maybe worried about their heart as well when they're feeling very stressed and anxious. And you're feeling that life is really difficult to cope with. And it's persisting over a period of time, over at least 2 weeks. And you're feeling it's happening more than not. It's also having an impact on your enjoyment of life. You're finding that you're feeling distressed by these symptoms. And also, if you're finding that it's impacting on your daily function, so it might be stopping you from going into work or working in the way that you'd like to work, or avoiding social situations that you'd like to engage in with friends. So when it's impacting both on persisting symptoms, impacting on your pleasure and enjoyment of life, and when it's impacting on your functioning, that's when I would say that you need to seek further advice and support.